This is a podcast from GwentTorfaen Talks CIC.
GwentTorfaen Talks CIC Dementia-Friendly Gwent podcast series. Today we're talking about what happens after a dementia diagnosis, a time that can feel overwhelming, but also full of support and guidance. We'll explore the roles of dementia advisors, memory assessment services, and the local dementia hubs, and how they work together to support individuals and families through the journey. Joined then today by Amrita, Stephen, Mary and Jane, also Sonya and Sarah. But the first question really is to Amrita. What does the diagnostic process typically look like for someone who may have dementia? Now, if somebody's concerned about their memory, what should they do?
Thanks, Patrick. So let's start from the beginning. If someone's worried about their memory, or maybe a family member notices changes, don't panic, don't ignore it. First off, occasional forgetfulness happens to everyone. Stress, poor sleep, being busy, or even not paying full attention can all affect memory. But if one starts noticing changes that feel unusual for them, like repeating questions, getting lost in familiar places, or struggling with tasks that used to be easy, it's worth checking out. Speak to your GP. The GP will ask about what's happening, things like forgetfulness, confusion, or difficulties with everyday life. They also want to hear from someone close to the person, like a family member or a friend, because they often notice changes that the person themselves might not. The GP will do simple checks like reviewing your medication, running blood tests, and doing some simple memory tests. Not all memory problems mean dementia. There are lots of other causes like stress, low mood, thyroid issues, vitamin deficiency, even side effects from medication. After the initial checks, if indicated, the GP will refer the person to the memory clinic for a detailed assessment. There are 7 memory clinics across Gwent. In the initial pre-screen appointment, the patient will be met by one of our memory nurses. There, the process will be explained and the opportunity to ask questions. We recommend that the person referred bring someone who knows them well, because they can describe any changes or problems they've noticed too. We will carry out some detailed, standardized memory tests to assess some of the person's thinking and mental abilities and take a history. The person may have already had or will be referred for a brain scan, such as a CT or an MRI. And the brain scan helps us to see if there are any changes in the brain. For example, any shrinkage in some specific areas, or any evidence of strokes or tumors. In Gwent, we now have access to brain PET scans, and these scans look at how the brain is functioning. These scans are useful when the diagnosis isn't very clear, or in younger people when the symptoms are unusual for the person's age. Once all that's done, the test, the scan, the history, the person is invited to see the senior psychiatrist, who will review the results and discusses what is most likely going on. If it does look like a dementia, we'll explain what type it is, the common ones being Alzheimer's dementia, vascular dementia, and talk through what it means for treatment and daily life. Treatment options will be discussed, and we will inform your GP of the plan. We will also provide written information after the appointment. We understand it's a lot to take all in at once. A diagnosis can be emotional, but it also opens the door to understanding and planning ahead. And just to finish, there's some really exciting news on the research front. A UK-wide study is being launched with Gwent as the very first site. The study brings together blood biomarkers, artificial intelligence, and genetic testing all working hand in hand to help doctors spot the signs of dementia earlier and more accurately. The hope that this approach will not only speed up diagnosis but also cut waiting lists and make the process more efficient for patients and family across the country.
How do memory assessment services support individuals and families during this time?
So our team consists of a range of professionals, including psychiatrists, memory nurses, occupational therapists, psychologists, and admin staff. All professionals in the team, they work closely together to share our expertise and knowledge to assist and support the person diagnosed and their families. We have links to speech and language therapists, physiotherapists, and other medical specialists, such as the care of the elderly specialists, neurologists. We also link people with community social services. During the diagnostic appointment, treatment options, care, and follow-up will be agreed, and we will inform the GP of the plan. Treatment may include medication and the option to participate in other recommended therapies for dementia. One such therapy is the cognitive stimulation therapy. It's a form of brain stimulation therapy which focuses on promoting the mental and emotional health of dementia patients. After the diagnosis, we'll arrange a follow-up contact just to check in, answer any questions, and make sure one is having the right support in place. Then there'll be regular appointments in the memory clinic so we can keep a track of how things are going and adjust care if needed. We also make sure that everyone leaves with our contact numbers, so if any questions or emergency arise, they know exactly how to reach us. Dementia affects everyone close to the person, so we always encourage families to get involved. We also offer training sessions for family members, friends, and other carers. The aim is for living well with dementia. It's about staying socially connected, engaging in activities one enjoys, managing health, and planning ahead.
Which kind of leads us on nicely to Stephen. Can you tell us about the role of a dementia advisor and how do they support people post-diagnosis?
We rely upon the memory assessment services to refer to us for our clients, predominantly that is. And I mean, what we do then is do a home visit, which is the best option. For me, I mean, I'll give you one example yesterday, in fact, two. You don't really know what you're going to find when you go into somebody's home and they are post-diagnostic. And often it can be a complex situation. And in this case, you find not only the person diagnosed with dementia, shall we say, but also perhaps there are some familial difficulties as well, say a spouse is unwell. And so my focus on an initial visit is really to get some building blocks in place to provide financial support for the client. In that regard, we do an assessment for attendance allowance and submit an application. And these days we can do that online, which is much easier. And so you can do that within 20 minutes for a client. And it takes an awful lot of pain and frustration and fear from the client in terms of being presented what used to be a 32-page booklet of different questions, whereas we can do it online and remove all that pain by simply asking the client questions. Attendance allowance does make a great difference financially for many clients, and I tend to do a benefits check, but we can do benefits checks by using the Citizens Advice Bureau or Care and Repair or other services available such as social housing providers will do a benefits check. But if you do that check, you often find that one, they're entitled to attendance allowance, which can mean up to £5,000 per year in terms of extra money. If it's a couple, as it was yesterday in both cases, it can mean in excess of £10,000 a year in terms of benefits being accrued. And then, of course, that's a gateway benefit then for things like council tax reduction, which is 25% per client at least, and also things like blue badges, which facilitate things like hospital visits where they can park and get into the hospital quite quickly and easily. So that's the benefits side of things sorted out for the client in themselves, and that makes a great deal of difference. And the quality of what we provide as dementia advisors is so important. The other sort of things I sort of emphasize the positives in life. In other words, what you can do, not what you can't do. So try and retain as much from your life as you continue on. And one example would be a client who was a very keen cyclist, but he could no longer cycle because he got lost and he fell off his bike. And so in this case, I provided advice upon a spin bike with a screen and software whereby he could then cycle through the Alps, around Lake Garda, or in the Florida Keys, And he was doing that for 2 hours a day, every day, which provided him and his wife with both respite, but also he retained that healthy living as well, which is a great thing to do, because many people, as all our professionals will say, post-diagnosis, it's a shock, and they tend to regress, and they tend to, shall we say, their lives get narrower because they are feared by the diagnosis itself. So it's so important to continue as much as you can, maintain contact and sociability as well. That's the sort of stuff that we do initially. I sort of say to people, adapt your lives and try and thrive. And there are ways and adaptations. There are some great agencies around, but Sarah, as I said, will come on to that.
Oh, excellent. Thank you very much, Stephen. So, Mary and Jane, can you explain how the Dementia Hubs operate and how they support people in the community?
Yeah, so I'm Mary and I man the Caerphilly Hub in Caerphilly Library. And what these are their centres for advice and support where individuals who are worried about their memory or anyone else's memory or any questions related to dementia can come and get our support. And although we're employed by Alzheimer's Society, a key aspect of the hubs is to work with partners to provide a multi-agency approach. So we have partners as part of our Dementia Hub steering group, and they can book in to sit with us on our hubs, and we sort of can...
We work with them, we collaborate.
Yeah, collaborate, and we can sort of swap expertise and referrals. And as well as this, we have resources in the hubs from lots of different organisations, such as Dementia UK. So another key aspect of the hubs is to ensure consistency across the local authorities. So the 5 of us, the hub dementia advisors in each of the local authorities, we collaborate very often. We like to meet and chat and sort of exchange ideas and what we've learned. And this ensures our best practice. Now Jane will tell you a bit about how we can support people in the community.
Thanks, Mary. Yeah, so what we're trying to do in the hub, we like to make it a very warm, welcoming, friendly, safe place for people. It's not clinical at all. A lot of people get very used to going into environments in a hospital that are perhaps a little bit austere. The hubs are lovely. They're all very friendly. You can have a cup of tea or coffee, make yourself comfortable. We're here to answer any questions you may have, discuss any worries and fears. We basically cater for all needs. So if somebody just wants to come in, have a browse through the literature, we have so many resources, so much literature that answers probably every question you can think of. And people sometimes just like to come in and sit down, have a little browse through, perhaps grab a coffee and have a little look, do their own little bit of research in private, that's fine. Some people like to use us as a one-stop shop. They'll pop in, they'll ask a question. They might have a very specific question they want to ask, whether it's about themselves or it's about someone that they care for, or just an issue they may be dealing with at that moment. That's absolutely fine. What we absolutely love to do is build that ongoing relationship. So we really are here to support people from the point of diagnosis right through till end of life care. We're here to help. And so depending on what your need, you may have a question and one need this week. Next week, it might be a completely different set of circumstances. We're not just going to throw a load of information leaflets at you. This is an ongoing process, and we're delighted to be here to help. Anything that is discussed in the hubs is absolutely confidential, to make that very, very clear. We can, with your permission and consent is a really important part of it, refer on to other organisations. We don't have all the answers in the hub, but we generally know an expert who does, and we can refer on as needs be. We have a duty of care to people, and we are here. So if anything, although I say we are absolutely confidential, should anything be disclosed that is a real worry, we linking with local agencies again to support and help with the safeguarding team. So it's very, very safe. We have assistive technology, which is absolutely wonderful. There's so many gizmos and gadgets that are available. Come in, have a look at them, see how they work. could they be helpful for you in your house or your loved one? It's great. Try before you buy is always a good thing. We can show you, once we worked out how to really work themselves, we can show you how they work, and it's great. They can be really, really helpful. As touched on already, Mary mentioned, we know everything that is pretty much going on in the area. There are so many support groups and there's so many different types. If you're a person that just likes a quiet one-to-one chat, there will be a resource for that. If you're somebody that likes a good rousing sing-song with a load of people, you love a quiz, you like, lots of things going on, we can let you know about that. So it's all tailored individually for people. So you can tell us what you need from us, and we'll do our best to help. We're also going to be a source of ongoing training and support. We undergo our own comprehensive programme of training so that we can be the best that we can be for you, to provide you with the best, most up-to-date information. But also we will be offering dementia awareness training and an opportunity to become a dementia friend. So it's all about raising information, that understanding, and spreading that knowledge and information. So aiming for a world where we all have that little bit of knowledge to support people living with dementias.
Mary and Jane talking about the dementia hubs, thank you. So to Sonya, what are some of the biggest challenges people face after receiving that diagnosis?
I mean, some of the challenges that people discuss, and it will be very dependent on each individual, and they will have their own experiences. But often people speak about the shock. Sometimes people have thought, maybe it's stress. I met a lady recently, and for months she believed that her symptoms or what she was experiencing, because of stress, and actually she ended up being diagnosed with Alzheimer's. So sometimes people are not expecting that, so there's a lot of shock. Fear, what does this diagnosis mean? How will it impact their lives? What will change? What will happen? Many people talk about the stigma. They feel ashamed and there's a stigma attached. And often they speak about the stigma in terms of memory loss and what will that mean for them and how will they be perceived? How will they continue to live their lives? Then there's kind of understanding the diagnosis. So what does that mean? Because often people are confused. We often have people ask us, what's the difference between Alzheimer's and dementia? And just not understanding what it means for them, what are the next steps, what support is available for them, how can they get that support for the person who's been diagnosed, but also for family and the people around them. They too will be experiencing kind of maybe some shock and confusion and wondering where to go. Also thinking how can they continue to live their lives, access, and if they've gone to groups and been part of the community, which is why we're trying to make our communities more dementia friendly. We're trying to raise awareness so that we can support people to live as well for as long as possible in their communities. For people then we need to think about cultural differences and what that means to people in terms of language. Sometimes there isn't a direct translation. For some people in some cultures this is not something that's easily understood, or they have questions about it, or again it can raise issues around stigma, about shame, people questioning whether this is mental illness and what that means. So again, clarifying that, raising that awareness and that understanding, making sure that people as well, because they think, well, what options are available, what can I do in terms of any treatment or medication, making sure that people have access to information about strategies that can support and slow down the progression of the disease. Again, people often ask about that and where to go. And so what we're trying to do is we're trying to make sure that we provide that information, that we tailor those messages to the individual. And again, I come back to that point of individual and the fact that everyone will have different experiences. It depends on the diagnosis. It depends on how old the person is. For some people, maybe they're still working. They have young children. They have mortgages. For other people, maybe they're at a different stage in their life. I met a woman recently in one of the hubs, and she was there with her daughter, and I was speaking to her and I was making eye contact, as I do when I speak to people. And she said to me, well, why she keeps looking at me, she said to her daughter. And she wondered why I was looking at her and making eye contact, because she said, I won't remember what you've said. And I said, that's okay. Your daughter is here as well to support and can relay the information. And it was interesting because she wasn't used to somebody speaking or making eye contact to her, because again, what people experience is that people get caught up in terms of the diagnosis, and people are not their diagnosis or their disease. They're still people, and we have to remember their personhood, their dignity is really important. And once she said that, and once she realised that I was going to continue to speak to her and make eye contact, she then talked about her own background, working as a senior nurse in theatre, and her own story. And so it's important to remember that everyone we meet, how their diagnosis impacts them, their story, who they are and where they come from is really important. But it's just providing that support, that individual support to the person and the people around them, and to our communities in general, because we can all be an ally, we can all support people post-diagnosis, and to raise awareness about what dementia is, the strategies, and what we can all do to support.
Sarah, how do you help to support and navigate this journey of dementia across different services?
So I think, as Sonya said, a lot of people they go in for their assessment, they get given their diagnosis, and then come out sort of very confused and lost, sort of trying to work out what support they need, what's available. And I think that our role as a dementia advisor, I always say to people, consider me a bit like your personal assistant. My role is to come in, is to have a look at what you've already got in place and what is available outside that might make your life a little bit easier. As Stephen said, we do benefits applications, but we also then have links with social services to look at things like carers and needs assessments, and we can make those referrals on people's behalf. We then also have links, we work really closely with the memory clinics, so if there's questions about medication, we can go backwards and back and ask about those. And as part of that then, because Memory Clinic is a multi-agency team, as Amrita said, they have, occupational therapists, physiotherapists, there's the nurses, there's psychologists. We have access to all of those services and those teams of people that we can then ask questions for on people's behalf. And we talk a lot about being able to have people feel part of their communities, to still be able to go and do activities and to be part of groups. And for some people, transport becomes an issue. If somebody's asked to refrain from driving or they live in an isolated location. So we can put people in touch with community transport schemes. People have assessments from the likes of Care and Repair to make sure that their home has got all the aids and adaptations that they need to be able to live safely at home. We can refer through to occupational therapy assessments for them to make sure that if they're out in the community, that they're safe, that they have road safety assessments or they have home safety assessments. We can talk about things like future care planning. So for a lot of people, having those conversations about things like lasting power of attorney, who they would like to make those decisions for them if they're not able to, we could help support with a lot of that. So I think what happens is that people aren't aware of just how much support there is available in their communities. And our role is to we regularly meet with different people from different agencies and different professions. And our role is to link people up with the relevant agencies and that relevant person for support at the time that they need it, so that people feel that they've got everything that they need and they're not having to go to lots of different agencies themselves. That is our role. It's our role to go out and help refer into those different agencies and get the support that people need.
And finally to Sonya, what improvements have you seen in post-diagnostic support in recent years?
We're very fortunate in Wales to have the All Wales Dementia Care Pathway of Standards, which provides us with a framework and which was co-produced and is supporting all the work we're doing around dementia, improving dementia care and support. And some of the improvements we've seen locally across Gwent is raising awareness of dementia, having those conversations in our community and engaging with people and listening to people and providing a kind of a feedback loop. We're going to where people are at, so we're not setting up specific groups. We're going to where people are already attending in the community, in schools, groups from all different types of groups, sports groups, community groups, people of all different backgrounds and ages. We want to be inclusive, and we're doing a lot to do that, to reach people from all backgrounds, to hear what is working well in terms of of dementia care and support. What do we need to do better? How would they like to be involved? So people's voices in the community is everything, and that's fantastic to see that we're doing that. And in order to do that, we have to work in partnership. This dementia is not about one specific discipline. It's not just about health or local authorities. It's about everybody coming together, third sector, volunteers, communities. It's about everybody's voice of all different ages coming together to be part of this, to create dementia-friendly communities, which we're very keen to work on and continue to improve. The Dementia Hubs has been fantastic for us to be able to set one up in each local authority area across Gwent is absolutely amazing, and to be at a place now where we have them staffed every day, so somebody can drop in, anyone, they're free, you can access information and speak to somebody and ask questions. Also, our dementia advisors, sometimes referred to as dementia connectors, so increasing that capacity so that everyone should have access to a dementia advisor at the point of diagnosis. And again, it means that rather than going from service to service, that you have that one person that can be, as Sarah said, a bit like a personal assistant that can really support and help people navigate the various systems. And it will, again, for many people, they will, often depending on where they are in their diagnosis, depending on their specific circumstances, they may need, different support. They may need information and advice. So having that person that can tailor that. Also, we have increased our dementia awareness training, and we're working on expanding our train the trainers, so they'll be able to deliver the Dementia Aware Plus training. And again, that really supports us in raising that awareness amongst our communities and providing that information and getting people on board to support those communities. And I guess as well, just raising awareness in general about the risk factors for dementia, the 14 risk factors. That's really important for everybody. But in terms of post-diagnostic support, the information we provide in terms of risk factors and support and looking after your brain is equally important for people post-diagnosis, because we know that the various strategies will help people. And some of the work we've done around that with partners in the health board and others in the community is to develop the meaningful engagement, the package, and we've got a Padlet, and people can access lots of information and support around kind of strategies and training and what they can do, and it's really informative. Everything is free. So that work has also been impressive, and it just helps us to improve and to provide that additional support to people living with dementia, to our communities and to their families in general.
So Sonya, Sarah, Mary Jane, also Stephen and Amrita, thanks for talking to us today. That brings us to the end of this episode. We hope you've gained insight into the support available after a dementia diagnosis. If you or someone you know is navigating this path, remember, you're not alone. Reach out to your GP or visit your local dementia hub for more information. Thanks for listening.
This is a podcast from Torfaen Talks CIC. For more details about what we do, look on our website, torfaentalkscic.org.uk.